Airway clearance is a foundational therapy for patients with chronic lung disease. We're talking COPD, bronchiectasis. If you do not deal with airway clearance and make it a foundational intervention, everything you do beyond that isn't going to work. If you just focus on antibiotic therapy, these patients, they get better and then they get worse, and they get better and then they get worse. And you have this cycle in and out of the doctor's office, in and out of the hospital. But once you recognize the importance of airway clearance and you address that issue with appropriate intervention, you break that cycle. And these people, they get healthy and they stay healthy. When a patient comes to see me and they give a story of recurring respiratory tract infections, lower respiratory tract infections, and I see their quality of life, and then I initiate high-frequency chest wall oscillation, invariably what I see in a relatively short period of time, sometimes as quickly as weeks, sometimes months, most of the time patients come in and they go, I feel so much better. I haven't felt this good and I don't know how long. These patients, they get their lives back. It's very dramatic. What about measurable metrics in terms of the effect that high-frequency chest wall oscillation airway clearance has in these patients? Reduced unscheduled physician office visits, reduced need for antibiotics, decreased emergency room visits, decreased hospitalizations. When these patients, they come back and they're feeling so much better, and they've been using this device for a matter of months, and they say, Dr. Seifer, do I still have to use this? I said, I've been wearing glasses since I was 8 years old. So are my glasses a treatment or a cure? And they go, it's a treatment. And with that treatment, I can see great. And so I say, your device is a treatment, it's not a cure. And if you stop using that device, you will go back to where you were before. Any patient who shows up in a clinician's office who gives a story of recurring lower respiratory tract infections necessitating multiple courses of antibiotics over a given year should be considered a risk and should be investigated for non-CF bronchiectasis and for airway clearance issues. If you think that somebody has a non-CF bronchiectasis, non-cystic fibrosis bronchiectasis, you order a high-resolution CT scan. It's a diagnosis that can be established in 5 minutes. So you have a patient who's been suffering for 20, 25 years, and in 5 minutes you can make the diagnosis and get them effective therapy and change the quality of their life. I get this question asked of me all the time. Would it have made a difference in this patient's lung function if you had diagnosed this disease 10 years earlier, or 15 years earlier, or 20 years earlier? And the answer is yes. It's a huge difference in terms of quality of life. Recognizing that patient, getting them appropriate therapy, then reducing the frequency of their exacerbations will, over time, improve the quality of their life and reduce the downward loss of lung function. What they care about is, are you going to make me feel better? Can my quality of life improve? And I'm telling them unequivocally, yes. And I can deliver on that promise because I have tools like the InCourage.